Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
We are getting a proper education about carpal tunnel syndrome. Our good friend Dr. Jitka Lom is here from Express Care. Doctor, some great questions tonight about CTS. Very, very painful, as you've said, but hopefully we can remedy this or at least tell people how to avoid it because it is quite uncomfortable. So let's go to question number 1. You ready?
Yes.
All right, this comes from Barbara from Mingilao. Dr. Lom, Barbara says, I've been a smoker for 15 years and I've noticed I've had some numbness in my hands. Are the two related?
Well, you know, smoking does impair healing of any kind. So if you have a little bit of pinching of a nerve, it will probably aggravate it and it will impair your healing. Would it be a direct link? No, but it might have not allowed you to heal as well as you would have otherwise. So do quit smoking.
How about the way people may hold cigarettes, you know, between their fingers? Yeah, you know, seriously, would that contribute, I guess, if they smoke enough? Or?
I guess it's possible.
Oh, okay. Well, you are the expert. Okay.
I really don't know.
Question number 2 is right up the street from Dedido. This comes from Anthony, and he asks, what are bone spurs, and how do they relate to carpal tunnel syndrome?
Okay. Well, bone spurs are little growths that you can have on pretty much any joint, any bone that's rubbing on another bone. And that can happen just from repetitive trauma or a single injury, even falling as a child and having an injury or actually a break on your wrist. You can get little tiny growths of bone. And those little bone growths can poke and pinch a nerve or other structure that's coming through. Usually that's not the case for carpal tunnel, but it can be, especially in the case of somebody who broke their wrist many years ago.
Someone common in athletes because of the kind of work that they do.
Yes.
So, all right, so.
Gymnasts.
Yeah, oh yeah, especially, I would think so. Nicole from Sinahani has question number 3, and she says, what kind of tests may be conducted to determine if I have CTS?
Right. So generally, it's a test that we examine you physically, check the wrist and tap here and see if there's any numbness or tingling on the wrist. And then you can also have a nerve study done, a nerve conduction test. And in that situation, they place tiny probes here at the one end of your arm and then on the different fingers, and they measure the electrical impulse of the nerve traveling through your wrist. And they can see, compared to the other nerves around, whether there's pinching and impairment of that nerve, kind of like an electrical cord, you know, seeing whether the light's flickering, that kind of thing. That test can be done, and then you can be, you know, guaranteed that yes, your nerve is being pinched. Sometimes it's really obvious though, because the nerve has been pinched so much that it's not supplying the muscles in the hand. So you'll actually find that this part of the hand, where there's normally a little bit of a plumpness, will be completely flat, and there will be weakness in the thumb and in the grip. And if that happens, it's very obvious it's carpal tunnel.
So that's a big. Is there anything that people can do at home just to, you know, in lieu of them having that kind of sophisticated electrical equipment? Can they, you know, like maybe do a resistance test or something like that?
Not really. I mean, it's just basically trying to keep the splint on so that you're not pinching the nerve worse, icing it, taking your Motrin, and then seeing about a steroid shot or a surgery if needed. You
probably know a very trained eye to look at that kind of thing, so you know what to look for as well.
Somewhat.
Okay, fair enough. All right, Santa Rita has question number 4, and this comes from Linda, Dr. Lom, and she asks, are there any home remedies, which I guess we just talked about, for carpal tunnel syndrome? Maybe if you already have it, aside from, you know, making a homemade splint or just, you know, dipping your hand in ice for
yeah, ice.
Which we don't recommend, by the way.
No, but for many people, weight loss is one of the remedies. If they could lose weight, they wouldn't have so much pinching, they wouldn't have so much swelling there. So weight loss can be a real good home remedy for carpal tunnel.
Simple
if you're
as
overweight, yeah.
Okay, well that's good to know. Barragata has question number 5, and we have 6 today, so this is the second to the last. And Victor asks, how can I know if I have carpal tunnel syndrome or if it's arthritis?
Right, so that's a good question too. So with arthritis, you'll have pain in the wrist and stiffness, but you generally won't have numbness and tingling of the fingers and weakness of the hand. It would just be confined to the wrist usually. Sometimes the wrist can actually be swollen, such as in rheumatoid arthritis, but most often it's osteoarthritis, basically wear and tear. So the people wake up in the morning and their wrist itself is stiff and sore, and it loosens up during the day and it feels okay, but they don't have that pain or numbness or tingling radiating into the hand. So could you have both? Yes, you could. You could have arthritis that creates some bone spurs, pinches your nerve, and then you have carpal tunnel also. It's possible to have both. So an x-ray would tell you about the bony part, whether there's arthritis of the bones in the wrist, and then the nerve conduction study would tell you about the function of the nerve.
Okay. And question number 6 comes from the capital of Hagåtña. Jessica asks, how do I keep CTS from coming back?
Well, it does come back sometimes, even after surgery, because that scar tissue from the operation can again start pinching the nerve. So proper aftercare after your surgery is very important. And again, trying to minimize your weight gain, trying to minimize the actions that cause that in the first place, the repetitive actions or the strains that you had. And quite often people will have it on one hand, their dominant hand, their right hand usually, and then a few years later develop it on their left hand if they are continuing to do those type of activities.
Okay, well, doctor, thank you. As always, very, very helpful information. Real quick before we go, you have a new teeth whitening service. How's that working out?
It's going great, yeah. Lots of people getting their teeth brightened and whitened, and you can come down anytime. Jason will invite you and brighten you up for the show.
All right, fantastic. I would love to. So it's only 30 minutes.
30 minutes, painless, safe, and guaranteed, money-back guarantee.
Okay, where are you guys once again?
At the Hagåtña Shopping Center, 2nd floor.
Good deal. Well, I'll see you there.
Thanks a lot.
All right, I'll see you next week as well.
Good.
All right, stay tuned. We are back right after this.